Hi everyone. In this video I'll be going over the upper eyelid eversion technique. There are many different reasons why we evert the upper lid in the ophthalmology practice. I've listed 3 common reasons, including papillae, looking for follicles, and then looking for foreign bodies. Now there's no one standard technique of how to evert the upper eyelid. Everyone has their own preference, and I'll be going over my own personal technique. This slide shows the face of the patient. Before I begin, I usually like to tell the patient about the technique, what they will feel, and what I'm looking for. That way they won't be surprised when you're picking and prodding around the lid. The second step I like to do is to use a drop of anesthesia just to make the patient more comfortable. In the third step, I will tell the patient to close their eyes and to look straight down. I tell them to look straight down because the procedure involves, around the upper eyelid, and so by having them look down, it avoids any involvement with the cornea. Now, you will need a Q-tip for this technique, and as I've outlined in my drawing, you really want to target the midline crease for this technique. Now, this slide here demonstrates that you will need to use both your hands to successfully evert the lid. One hand will be holding the Q-tip, and it will target the midline crease that I've mentioned in my prior slide. The other hand will grasp the eyelashes and the eyelid, and it will pull towards the examiner. Once the eyelids are pulled, the Q-tip will be, and this is in my technique, I will point slightly towards the globe, not parallel, and once this is in place, I will then evert the lid around the Q-tip. If you did this correctly, then you will notice the underside of the lid. The hand holding the lashes and the lid should stay in that area. The other hand holding the Q-tip should be removed. If you did the procedure correctly, this is what you would end up with. Again, as you can see in my drawing here, the patient is looking down. This is the part where, with the slit lamp, you will look for foreign bodies, papillae, and follicles. Once I'm done, I manually pull the lid downwards and then tell the patient to look back in neutral position, and this should be the end goal. That's the end of the video. I hope you found this useful. If you have any questions or comments, please leave them in the comment section below. Thank you very much.